Welcome everyone to my YouTube channel. I am Dr. Swati Mehta. Today we will discuss abnormal uterine bleeding, commonly known as AUB. This condition is one of the most frequent gynecological complaints encountered in clinical practice. We will understand its definition, causes, diagnosis, evaluation, management, and the important homeopathic remedies indicated for different types of abnormal uterine bleeding. To understand abnormal bleeding, we must first know what is the consideration of normal menstruation. A normal menstrual cycle occurs every 28 days with a variation of plus or minus 7 days. The average duration of bleeding is about 4 days, and bleeding lasting more than 7 days is considered abnormal. The average blood loss during menstruation ranges from 35 to 50 milliliters. Interestingly, many women misjudge the amount of blood loss. Some women with excessive blood loss believe their flow is normal, while others with minimum blood loss consider it's heavy. Therefore, clinical assessment is essential. Menorrhagia refers to excessive menstrual bleeding occurring at regular intervals. The bleeding lasts more than 7 days or exceeds 80 milliliters of blood loss per cycle. Women suffering from menorrhagia often experiences fatigue, weakness, anemia, reduced work capacity, emotional stress, and decreased quality of life. It affects approximately 9 to 14% of healthy women. Metrorrhagia refers to uterine bleeding occurring at irregular intervals between menstrual periods. Menometrorrhagia combines both excessive and irregular bleeding when prolonged bleeding occurs unpredictably. Oligomenorrhea, on the other hand, means infrequent menstruation with cycles extending beyond 35 days and sometimes up to the 6 months. Abnormal uterine bleeding may arise from systemic disorders affecting the entire body. Common causes include coagulation defects, leukemia, idiopathic thrombocytopenic purpura, and thyroid dysfunctions. Both hypothyroidism and hyperthyroidism can disturb hormonal balance and produce heavy or irregular menstrual bleeding. In adolescents presenting with severe bleeding from menarche, bleeding disorders should always be considered. The reproductive tract itself may be responsible for abnormal bleeding. Gestational causes include abortion, ectopic pregnancy, and thromboplastic disease. Malignant causes include cancers of the endometrium, cervix, and ovary. Benign causes include fibroids, polyps, infections, cervical lesions, atrophy, and retained foreign bodies. Postmenopausal bleeding should always be evaluated carefully because it may indicate the endometrial cancer. Leiomyoma, also known as uterine fibroid, are major cause of heavy menstrual bleeding. The proposed mechanism includes increased blood vessel formation, enlarged endometrial surface area, impaired uterine contractions, and local clotting abnormalities. Other contributing factors include a retroverted congested uterus and certain medications such as intrauterine device, steroids, and psychotropic drugs. Dysfunctional uterine bleeding or DUB is abnormal bleeding without any detectable organic pathology. The most common cause is anovulation. During an anovulatory cycle, no corpus luteum forms, leading to absence of the progesterone production. Estrogen continues to stimulate the endometrium that causes excessive thickening of the endometrium. Eventually, irregular shredding occurs, which results into abnormal bleeding. Prostaglandins play an important role in regulating the menstrual bleeding. Progesterone promotes the formation of PGF2. The formation of PGF2 alpha, which cause vasoconstriction. When progesterone level falls in anovulatory cycles, the ratio of the PGF2 alpha to PGE2 decreases, and this causes vasodilatation instead of vasoconstriction that leads to excessive bleeding. Proper evaluation begins with a detailed menstrual, medical, and family history. Laboratory investigation includes complete blood count, pregnancy testing, hormonal assays, coagulation profile, and thyroid function test. Physical examination includes pelvic examination to identify any structural abnormalities, additional investigations such as ultrasonography, hysteroscopy, laparoscopy, HSG, and endometrial biopsy. It may be required depending on the patient's age and symptoms. Before starting treatment, pregnancy and malignancy must always be ruled out. Management includes rest, assurance, correction of anemia, treatment of endocrine disorders, hormonal therapy, NSAIDs, antifibrinolytics, and surgical intervention when necessary. The treatment plan depends upon the cause, severity, age of the patient, and future fertility disease. So all these are the management with allopathic mode of treatment. Progestins are particularly useful in anovulatory abnormal uterine bleeding. They inhibit endometrial growth, suppress estrogen receptors, promote organized shredding of the endometrium, and restore the hormonal balance. They are especially suitable for the adolescent girls because they do not interfere with maturation of the hypothalamic pituitary ovarian axis. Patient who fails medical therapy may require surgical treatment. Options include endometrial ablations, thermal balloon therapy, resection procedures, and hysterectomy. The choice depends on the age, severity of the symptoms, desire for future pregnancy, and underlying pathology. Now let us discuss the homeopathic therapeutics of abnormal uterine bleeding. Homeopathy approaches AUB in a holistic and individualized manner. Rather than focusing on a stopping of the bleeding, the aim is to identify and treat the underlying cause, restore hormonal balance, improve uterine health, and strengthening the patient's overall constitution. Abnormal uterine bleeding may result from hormonal disturbances, anovulatory cycles, fibroids, uterine congestion, endometrial abnormalities, stress, anemia, menopausal changes, or constitutional weakness. Homeopathic medicines are selected on the basis of the totality of symptoms, include the nature of the bleeding, associated complaints, mental state, causative factors, and characteristic individuals. Ammonium carb is especially indicated in stout, flashy, sedentary women who are prone to catching cold. The causative factor is venous congestion and poor circulation. Menses are too early, profuse, dark, clotted, aggravated at night. A peculiar symptom is soreness of the thighs from the acrid menstrual discharge. The patient often experiences toothache, yawning, fatigue, chilliness, and weakness during menstruation. Patient is having aversion to sex. With this, patient is having bleeding piles aggravated during menses. Menses is aggravated from washing and better by lying on abdomen and better by painful side. So the keynote is relief from lying on abdomen is the peculiarity of ammonium carb. Menorrhagia is suitable to thin, nervous, emotionally sensitive women. This medicine is useful for Metrorrhagia. Bleeding occurs between the periods after slightest exertion, walking, or even after a difficult stool. This is the peculiarity. Patient is extremely shy and becomes uncomfortable in the presence of strangers. So there is great sadness and sits for days for weeping. So peculiar symptom is weeping when hearing music. Bleeding from the slightest cause is a strong indication of Menorrhagia. A long walk or after every hard stool, if bleeding is there, and patient is having aggravated by lying down and the in presence of many people or after waking, better after eating cold food and drinks. These are indications we can say about the Menorrhagia. And one peculiar symptom, that is nymphomania, itching of the pudendum with soreness and swelling, is also one of the cause of Menorrhagia to indicate. Elateris farinosa is the remedy for exhausted woman who is severely anemic. It is useful when anemia, malnutrition, repeated pregnancies, or chronic blood loss produce uterine weakness. Menses are premature, profuse, and associated with labor-like pain. The patient feels tired constantly and suffer from fainting spells. These are the symptoms peculiar for the anemia, and elateris farinosa is also medicine for anemia. A peculiar symptom is sensation that the uterus feels heavy and tend to prolapse. Terrible pain during stool. Patient feels tired all the time. Premature and profuse menses with labor-like pain and severe anemia are the indications of elateris farinosa. Halonius is one of the best remedies for uterine atony. So atonicity of the uterus leads to profuse bleeding. We can use Halonius. The causative factor is prolonged blood loss causing weakness and exhaustion. Menses are frequent and profuse with dark offensive blood. The peculiar symptom is constant consciousness of the womb. Patient always feels consciousness of the womb. Patient wants to be let alone. Very irritable patient, fault-finding patient, and cannot endure the least contradiction or receive the least suggestion. Mental depression improves when the patient remains busy and occupied. There is foul, lumpy, or curdled leukorrhea, always better when occupied and not thinking about the ailment. Patient is restless, must be continuously moving about. Loss more blood than it may be in the intermenstrual period, which is dark, foul blood, and there is swollen breast with painful nipple, tenderness of the nipple, and debility attending the menopause are the indications of Halonius. So this medicine is also used for the premenopausal syndrome. Bovista is indicated in women with irregular uterine bleeding and marked awkwardness. So awkwardness, inclined to drop the things, objects fall from the powerless hands, awkward in the speech and action. The characteristic symptom is menstrual flow occurring mainly at the night. So patient have never the flow during daytime but only at the night, and it is aggravated in least motion. Diarrhea before and during menses. Menses may appear every 2 weeks and are dark and clotted. So this is the indication of Metrorrhagia. Intolerable itching at the tip of the coccyx. Must scratch till the parts become raw and sore. That is also peculiarity of Bovista. Metrorrhagia and para-ovarian cyst. That is the cause of Bovista. There is thick, pussy, acrid leukorrhea. Diarrhea before and during menstruation is also a peculiar symptoms previously we discussed about. And patient cannot bear tight clothing around the waist like nux vomica and lachesis. Calcarea carb is suitable to a fat, fair, flabby woman who perspires easily. The causative factors includes hormonal imbalance, obesity, overwork, and constitutional weakness. Menses are early, prolonged, and profuse. The least excitement or exertion may restart the bleeding. Peculiar symptoms include cold, damp fit, craving for eggs, excessive sweating of the head, and displacement of the uterus. So, patient is having too early, too profuse, and too long-lasting menses with vertigo, toothache, and cold, damp fit during periods. And this period is aggravated by least mental excitement or physical exertion. Then we can consider about the calcarea carb, where uterus is easily displaced and there is increased sexual desire with tenderness of the breast, which is aggravated before menses. Irigeron is a valuable remedy for bright red hemorrhages, mainly used for the Metrorrhagia and Menorrhagia both. The bleeding is aggravated by slightest movement and comes in sudden gushes. So gushing bleeding in between the periods, we can consider Irigeron. Menses returns after the least motion, we can consider Irigeron. There is associated irritation of the bladder and rectum. So patient is having bleeding hemorrhoids or sometimes nosebleed instead of menses. That means epistaxis in place of menses. Hemorrhage from the uterus with painful micturition. So infection is also there. Leukorrhea with urinary irritation, that is also present. And bloody discharge on slightest exertion. Bleeding hemorrhoids often accompany the uterine bleeding, and there is a peculiar symptom, that is nosebleed or epistaxis replacing the menstruation. We can think about Irigeron. Trillium is one of the foremost remedy for profuse uterine hemorrhage. Menses every 2 weeks and lasting a week or longer, and after overexertion or too long ride. These are the causes of trillium pendulum. The causative factor: overexertion, menopause, fibroids, and uterine displacement. So wherever patient is having premenopausal profuse bleeding or having history of fibroids and there is a profuse bleeding, we can think about the trillium. I had used many times trillium and got the perfect results. The bleeding is bright red, profuse, and gushing. The peculiar symptom is sensation that the hips and back are falling apart. So severe backache patient is having, and that is also one of the symptom you can consider peculiar in premenopausal syndrome. The patient seeks relief from tight bandaging around the pelvis. So backache is better by tight bandage. That is also peculiar of the trillium pendulum. Thalassemia bursa pastoris is highly effective for the hemorrhage associated with uterine fibroids. I have used many times in my practice and get the marvelous and wonderful results. Bleeding is accompanied by large clots and violent uterine colic. A peculiar symptom is every alternate menstrual period is profuse. And this type of symptoms you can find out when you get the case history, clinical history. You can find this symptom every alternate period very profuse. We can think about the thalassemia. I had this type of patient and treated with thalassemia. Menses tardy in starting. The first day merely a show, second day colic, vomiting, and a hemorrhage with large clots. This is the peculiarity of thalassemia, that only first day only a show. Patient is not having profuse menses, and second day there is severely colic. And menses starts from the third day. This history you can find out when you take the case of the patient. Patient often craves buttermilk and experiences offensive bloody leukorrhea. Metrorrhagia after abortion, after labor, after miscarriage, at the climacteric, or with the cancer uteri, we can think about Thalassemia bursa pastoris. Ustilago is particularly useful for the bleeding from fibroids, miscarriage, and hypertrophied uterus. Metrorrhagia and Menorrhagia both are covered with this medicine, and at the climacteric, if patient is having profuse bleeding, we can use Ustilago. The blood is dark, stringy, and form long black clots. So menses is half liquid and half clots, or stringy, dark, vicarious, that means nosebleed in presence of menses. Ustilago is the indicated. Partly clotted and partly fluid, another indication, that is of the sabina. Here also in Ustilago we can use the same symptoms. Uterus is hypertrophied, feels soft, spongy, or boggy. That means the climacteric changes. Cervix bleeds easily and soft and spongy. That is the indication of cervical carcinoma because it bleeds when touched. That is the peculiar symptom of cervical carcinoma, and Ustilago can be used for that also. Metrorrhagia with vertigo during climacteric is the indication. Metrorrhagia with displacement of the uterus, or between menstrual periods there is heavy dragging backache on exertion and pain shooting up back from the hip to shoulder. Abdomen tender to touch and aggravated by slightest movement are the symptoms of Ustilago. The peculiar symptom is constant pain beneath the left breast between the menstrual periods. That is also an indication of Ustilago. Sickle core is indicated in thin, weak, cachectic women. Bleeding is dark, offensive, continuous, and often watery. So we can say it's a passive hemorrhage, which is fluid type, and this bleeding starts from the first day of the menstrual discharge till the next period, but in between very scanty, or you can say less in amount, but it is continuous from the first period to the next period. The causative factor is uterine degeneration and poor vitality. The peculiar symptom is burning sensation, burn like a fire, and patient is feeling chilly but does not want to cover. These are the peculiar symptoms. The leukorrhea is brownish and offensive. It can be used for carcinoma of cervix. Numbness, insufferable tingling, crawling, twitching, gnawing, or cramping type of pain with stiffness in single parts. It starts in the face or back, in limbs, in fingertips, and there is after the pain, there is burning. Ipecac is a leading remedy when severe nausea accompanied with uterine hemorrhage. Metrorrhagia is the indication for ipecac. The bleeding is bright red, profuse, and may occur with every gush causing breathlessness. So this is a typical symptom that patient is having. As soon as patient discharge the blood, patient is having breathlessness. Great debility, the slightest effort induce perspiration. Great weakness during menses and irregular menses is the indication of ipecac. The keynote symptom is persistent nausea not relieved by vomiting with clean tongue and thirstlessness. Leukorrhea is acrid, thick, slimy, corroding the linion, and there is wedge-like pain in the right ovarian region. Bleeding is active or passive, but bright red in color, profuse and clotted and heavy. Crotalus horridus is indicated in menopausal hemorrhage and malignant uterine conditions. So patient is having flushing, hot flushes, you can say intense flushing and drenching perspiration. Patient faintness and sinking feeling at the stomach, and there is prolonged metrorrhagia, dark fluid, offensive with profound anemia. Peculiar symptom is excessive talkativeness combined with a desire to escape. So talkativeness is also common with lachesis, but in lachesis there is regular menses. It is also used for the menopause where there is a hot flushes, profuse perspiration. But Crotalus horridus, the blood decomposition and hemorrhage are present where there is a dark fluid without clots. Prolonged menses, uterine hemorrhage with faintness at the stomach, that is dysmenorrhea, pain extend down to the thighs with aching in the region of heart. Patient is having weeping mood, clouded perception, and weak memory. And that is the peculiarity of Crotalus horridus. Several mother tinctures are frequently used as supportive remedies in abnormal uterine bleeding. So to stop the bleeding, we generally use these mother tinctures, especially Hemamelis, Donosia ashoka, and Ficus religiosa, combined in one bottle. I always allowed patient to take 15 to 20 drops in a half cup of water 3 to 4 times a day to prevent the excessive hemorrhage. Now this includes Hemamelis for passive venous hemorrhage, Donosia ashoka for uterine tonic action, Ficus religiosa is for excessive bleeding. Sometimes we use phosphorus for the bright red hemorrhage, 1 drop of phosphorus 30 in a 1 tablespoon of water given to the patient, that will stop any type of hemorrhage. Also the melifolium for profuse bleeding for minor cases. This selection should always be based upon the individual symptom picture, but as I give you the guidance, you can use it for your patient. To conclude, abnormal uterine bleeding is a common yet important gynecological condition required careful evaluation. Identifying the underlying cause, correcting the systemic factors, and selecting the appropriate individualized homeopathic remedy can greatly improve patients' outcomes. Thank you for watching my video. If you found this presentation is helpful, please like, share, and subscribe for more educational homeopathic content. Thank you so much.